Hi, my name is Julia Snodgrass. I'm from West Plains, Missouri. West Plains is a small town about an hour and a half south of Springfield, almost to the Arkansas border. In that area, we have quite a few rivers, and we have the Norfolk Lake and the Bull Shoals Lake, so there was always something to do there in the summer. I played volleyball, and I was involved with numerous clubs in high school. I grew up on a cattle farm, so between that and living in a small town, I had plenty of unique learning experiences growing up. There were a few significant events in my life that have shaped who I am today. One of those, one of the most significant events was a family member being diagnosed with myasthenia gravis. To the doctors who initially took care of my family member in the emergency room, it presented as a stroke would. However, this is actually a chronic autoimmune neuromuscular disorder that causes weakness in the skeletal muscles, specifically ones responsible for breathing, moving different parts of the body. There would be paralysis in arms and legs. Before this, I had not been through the overwhelming experience of finding a specialist, determining a diagnosis, and learning about a whole new disease in order to fully understand what was wrong with the family member. I learned how different of a process this was from the patient's family's point of view than it was for the physician. For a doctor in this situation, it was simply a daily routine to diagnose and treat patients. However, for our family, it was a relief and a significant milestone in helping our family member get well. We have a small, very tight knit family. Therefore, it is an ongoing joke between us that if any of us are sick, the rest of us camp out in the hospital room. To some hospital staff, this could be seen as a nuisance or extra work for them, in order to deal with 10 extra family members. When we do run into someone who is understanding of this unique quality, it means the world to us. In the future, I strive to be understanding of other families' different methods of coping with a sick family member, and I hope I will not be the type of doctor to get annoyed with a family support system because I know how important it can be. Uh, I first heard about this program from a friend's older brother who was accepted. I had not heard of UMKC or the program before this. Mitchell and I both went to high school together, and we both knew my friend's brother, so we had plenty of questions for him. But before that, I wanted to be a lawyer. I even job shadowed numerous lawyers in town. But after we learned about the program, I decided to look into the medical school and into that profession. But I also wanted to keep an open mind. I was skeptical, and the first doctor I job shadowed was actually one who had graduated from the 6 year BAMD program in the past. So she had lots of insight and advice for me. After following her, I spent the rest of my summer with a local neurologist in West Plains. She showed me the value of building trust between patients and having that close relationship. And I learned what it was like practicing in a small town. So now, eventually, I would like to go back to West Plains and serve that community.